Pain and inflammation is one of the things that people commonly come into a chiropractic office, and one of the challenges is finding out the source of that pain, because one of the greatest frustrations that I had is I've been in practice now for 18 years, and about 5 years into my practice, I was seeing patients, and on certain patients, I would keep adjusting them over and over again, and in the same area for the same pain, it would just keep coming back, and there would only be temporary relief. And so I've spent many hours, much time and energy and money to learn things, postgraduate work that could identify why people kept coming back. That's how I got involved with nutrition. That's how I got involved with muscle testing and identifying painful things and getting to the root cause of those painful symptoms in their body. One of the tools that I use that is very effective is finding out what their adrenals are doing, because pain and inflammation can result from your cortisol being depleted. Cortisol is secreted in the adrenal glands, and it controls not only pain, but it also controls things like glucose metabolism, which is blood sugar balance, and we'll get into that a little bit later as well. But right now with pain, we have to find out what the cause of the problem is. So the things that when someone comes in here is you have to identify how is it affecting their life, and pain can obviously affect their performance at work, their ability to enjoy activities with their family. It can even make you feel depressed if it gets to a certain point. But getting to the source will help solve the problem. And so one of the first tests that we do is not only muscle testing. There's inflammation and pain points, but we also do a saliva test, a 201 test from BioHealth, which would determine how your adrenal gland is doing. Is it fatigued? And if it is fatigued, it's not secreting enough cortisol, which cortisol is a pain modulator as well. So let me show you here an example of someone that has an imbalance in their adrenal gland based on this test. So this test is a 33-year-old male, and he came complaining basically of pain in his low back. He's left-handed, and he has pain sometimes in his wrist when he overuses it. And I told him that some of the symptoms that he is having is actually from his cortisol being depleted, and so I tested his adrenal glands using a muscle test, using the procedure that we use here in the office, and it showed that his adrenals were fatigued, and so I told him that he needed to we needed to verify this with a BioHealth 201 test. So we did that, and this is what it came up with. So what we're looking here is we're looking for three things. One is the cortisol reading. The second thing is, how's the cortisol measuring throughout the day? What's the rhythm? And the third thing is the DHEA level. And as we can see, the cortisol controls inflammation and pain, and also controls, like we talked about, glucose. It's a glucocorticosteroid, which balances out blood sugar levels throughout the day. So cortisol manages basically any type of stress. It could be a blood sugar imbalance, it could be a pain, it could be a depression, or managing some kind of a stressful event. And DHEA manages, it's basically an anti-aging hormone. The higher the DHEA level is, the better it is, because the body is able to counteract early aging mechanisms. And so the higher it is, the ability to handle that aging is better. So as you can see here, he has good cortisol level in the morning, and at night, in the afternoon, like about noontime, it goes up. In the afternoon, it goes down, and at the nighttime, it goes up. So he's going up, down, up. You want to be right in between these levels right here. Okay. So the X's are his levels, and the the other two with the triangle and the square is where you want to be in between. So he's going up and down, and what that means is that he's got, he's actually good during in the morning, and then in the afternoon he's got some kind of a stress that's going on that's raising his cortisol levels. And in his particular case, it was because of a wheat intolerance or gluten intolerance. That's a very, very common intolerance in people, and as nowadays going gluten-free is very actually something very becoming more and more popular. And then in the afternoon he's going down, and so this is where he starts to shut down and he starts to feel tired. It's very common to feel tired in the afternoon, but I know just from personal experience and all my patients' experience that when we balance their cortisol levels, their fatigue goes away in the afternoon. And then at nighttime he goes up, which is not a good thing either, because you want it to be lower at night so that you can get good sleep. So people like this tend to think, when they at night they tend to process things more at night, and sometimes have a difficulty getting to sleep, and sometimes have a difficulty staying asleep, or both. Last thing that we want to discuss for this particular patient is their DHEA level. You want ideally at least a 6 or a 7, preferably 7, 8, 9. And as you can see, this level has started to go down. And so I'm going to show you a diagram of how this works in terms of the stages of adrenal exhaustion. This is the diagram of how the stages of adrenal exhaustion happens throughout life. Ideally, the level that you want is right here at about 30. I'm going to show you in a pointer here. So a little, between 30 and 40 is ideal. Okay, and this is your cortisol level. So the higher you go, that means stress is going up. So if you go through stress, it starts to go up. And here, if stress doesn't stop, your cortisol levels are constantly being taxed, and so it's going to continue to go up higher and higher. So this is with sustained stress, and you've reached at this phase or stage 1 of adrenal fatigue or exhaustion. Well, if that stress does not leave and it stays continued, then that cortisol level will eventually deplete. Now, this can happen over a period of years. You don't know how long it's there for, and it could be from multiple different types of causes. And if that stress continues, or you have multiple stresses that one right after the other, cortisol levels will continue to go down into a stage 2. And again, if that continues to progress further, then you got stage 3, which is the last stage, and then that leads to adrenal failure. So, they can actually feel pretty good throughout this whole process. I've seen people in stage 3 and they feel fine. And that goes to show you that our body has an amazing ability to handle the stresses from our environment. But there's a good and bad to that. If you can handle a lot and you have a high pain or stress tolerance, your body gets damaged in the process and you don't even know about it. And it's like hidden high blood pressure. You don't know you have it until many of the men actually their first symptom is death. Well, you won't die of an adrenal exhaustion. Can it shorten your life? Absolutely. So can it make your life miserable? Absolutely. So in the last case that I showed you, the patient, he was in actually stage 2. His cortisol reading was right here. Okay. And his DHEA level was going down, because normally when you have in stage 1, which is right through here, your DHEA level, which is dehydroepiandrosterone, goes up in response to the cortisol going up. So as soon as your cortisol goes up, DHEA will go up to counterbalance the cortisol. Your DHEA acts opposite to cortisol. In his case, it went up, his cortisol continued to go up, his DHEA went up to try to bring it back down. But now, not only are you running out of cortisol as this goes down, but you're running low on DHEA. Now, if he doesn't do something about it, his cortisol levels will continue to go down, and his DHEA levels will continue to go down. And I've had people really like in stage 3 with a DHEA level between 1 and 2, and that takes quite a while to fix. In this particular situation, in the 33-year-old gentleman, it's going to take at least probably a year to fix this, and someone in stage 2 is going to take 1 to 2 years. Someone in stage 3 is going to take probably 2 years plus to really fix this problem.